Good morning once more. My name is Thilly Mokete. Today I'll be presenting to you mental health and HIV as our topic. Mental health and HIV are closely knit, and in South Africa the statistics are actually shocking because South Africa has got the highest stats the world over. And what is really breaking our hearts, or what is a big problem, is the fact that in South Africa, HIV affects the younger population. We're going to be looking at a number of issues regarding HIV. The first one that I'd like us to address is that of the issue of stigma. Almost all infected people suffer from stigma of HIV because they believe that they're going to be ostracized. They believe that people are going to know about their status, and they feel ashamed about their status, and they believe that they're going to be set aside, and people don't want to communicate with them or don't want to mix with them, or their families are going to chuck them out, whatever the case is, but they feel they are not going to talk about it. They're not going to accept the HIV status, and they are not going to go on to treatment or deal with whatever consequences that come with the HIV. People with HIV, especially the young ones, or especially the ones that have just been diagnosed, most of them suffer from guilt feelings. They start to blame themselves. They shouldn't have gone out, or they shouldn't have drank, whatever, or they shouldn't perhaps have been on drugs, or they shouldn't have associated with whoever. And these guilt feelings make them unable to disclose their status once more. Again, it's not only guilt feelings, on their own, it's anxiety and depression at the same time. If they are scholars, some of them stop going to school, or they stop going to work. So it's one trip of guilt feeling after the other. And females and males all get infected with HIV, but males are the ones that are even worse because they have got more sexual partners than the females, and they would carry the infection from one female to the other, or from one male to the other. They actually have more partners, and it's acceptable in the culture where we are that males will have more partners and females should not have more than one partner. They refuse to wear condoms. The male people in communities refuse to wear condoms, especially in the Black culture. They believe, no, they are in charge. They are the ones that must, tell the women what to do. And in South Africa, most females get raped by males. As a result, the HIV infection spreads easily from one female to the other, or one male to the other. Okay. People that are infected with HIV, initially they will start off with sexually transmitted infections. And the fact that people get easily infected and HIV is not painful, they don't feel anything. But once they have sexually transmitted infections, it's only then that some of them will go to the clinic to report, and then they get tested. And once they get tested, they test positive for HIV, then that's when they will start to know. But some of them don't even go to the clinic to get tested. They still stay at home with the STI that hasn't been treated, or STI that has been treated, and they continue with their lifestyle of having more than one partner or engaging in sex without condoms. Young people, especially females, get tested for HIV when they are pregnant, because this is a treatment modality that has been implemented in South Africa, where every female that gets pregnant needs to be tested so that infection of HIV is stopped and the pregnant woman does not pass the infection onto the unborn baby. Anxiety and depression also set in. If it's a pregnant woman that is married, she gets very much anxious, she gets very much depressed as to what's going to happen with the unborn baby, what's going to happen with herself, or what's going to happen with some of the children in the family. Treatment and health professionals. Most healthcare services provide an up-to-date ARV treatment in the clinics. These services have actually reduced the disease burden of HIV, and a lot of females, a lot of people, even males, continue to live their lives, continue to work productively, even when they are HIV positive. Support groups have been established in most clinics, especially the primary healthcare clinics, where individuals assist one another with how to care for themselves, how to continue with medication, how to continue a lifestyle that is productive. And we see quite a number of people that continue to live productively. The burden of care has been reduced from family members, even though we still experience a lot of children whose parents have passed on because of HIV. A lot of orphans, a lot of orphaned and vulnerable children live out there without assistance from maybe the old go-go or whoever, but support groups are there to assist. HIV treatment is very simple. A lot of patients take just one tablet daily, and it has actually assisted those patients that were taking quite a number of tablets in the beginning. And now we see one tablet daily. It's either they take it at night, or if that's their option, or they take it in the morning, and that is it. And they continue to live, and they continue to be healthy, and they continue not to pass on the infection to others or to their partners. The last slide. In conclusion, HIV carries with it a lot of challenges. For an example, if a young girl gets pregnant or she gets raped, she gets pregnant, the first thing that she thinks of is suicide, some of them. Others are not thinking of suicide, but they don't want to tell the family members or their siblings or whoever, their husband, because of fear of death. They think they are going to die. Some get divorced because they do not believe that they are HIV positive, and they think that being HIV positive is the end of life. There are a lot of mental health issues that come with HIV. Clients get depressed. They become anxious. They isolate themselves, and it's just a vicious circle with HIV and AIDS. This is the end of the presentation for today. I appreciate